I'm Dr. Michael Miyazaki, and we've made a lot of videos on clinical topics. And what I wanted to do today is spend a little bit of time on something that's probably just as important as the clinical side, and that is just our personal side. How do we as dentists stay sane? It's a crazy business, and it's always changing. It's always adapting, or we have to adopt new things. And I was this week I was reading a quote from Jim Rohn, and the quote is, "Your life does not need, or your life does not get better by chance. It gets better by change." And one of the things is, as I go about the country and I meet dentists from all over, not just in our country, the United States, but all over the globe, what I see is that we have very similar frustrations. When I look back at my career, starting dental school over 40 years ago, and the things I was taught back then compared to how I actually practice dentistry today, it's changed quite a bit. And yet, when I go out there and I'm working with a group of doctors, maybe teaching them something that's new that excites me, maybe it's a way of doing root canals or placing dental implants or looking at occlusion or looking at aesthetics, sometimes I'll have doctors in the room and they go, "Well, why would I want to change?" And I'll just ask them, "Well, how are you doing that direct composite restoration?" "Well, I do it the same way that I learned in dental school. And I'm basically using all the same products that I was using in dental school." And these are doctors that have been out of school for 30 to 40 years. And I think to myself, I don't think I would use any of those materials. Materials have gotten so much better in the last 5 years. Why would I want to use a material that was from, let's say, 10 or even 20 years ago? Change is hard. In our profession, when we have success in using a certain burr or a certain adhesive, it's very hard to let go of that. It's like we're on this precipice, a cliff, and someone's saying, "Here, grab my hand." But in order to grab my hand, you're going to have to let go of whatever you're holding on to, the ladder or the rope on the other side. And what we have to do is we have to trust that when we let go of what we're already holding on to and we move on to something new, that new side is going to hold us up and we're going to be safe there. So I think what we as clinicians have to understand is that when you look at other businesses, when you look at other professions, the way they do heart surgery today isn't like they used to do 30 years ago. 30 years ago, they'd always have to crack the chest open. Today, sometimes they'll find more minimally invasive ways of going in. When you have your appendix removed, I just had a patient this last week who had to go in for emergency appendicitis, and she's 80 some years old. Kind of surprised her. But again, the surgery was minimally invasive. It was laparoscopic, and she came out and she was amazed at how easy it actually was. Whereas before, when we were young, they'd have to create the incision and it would be a fairly invasive surgery for something relatively small. Dentistry is the same way. Today in dentistry, we know that we don't have dentistry that will last forever. So what's the best dentistry? Maybe sometimes no dentistry. Of course, we have to do treatment when it's required, but we have to understand that our treatment doesn't always last forever. So let's start out conservative. And then if we have to replace it, we have a lot of teeth to work with. And then if we have to be a little bit more aggressive in our preparation, hopefully that's going to be years down the road. And I think it's very important for us to understand that dentistry has changed. I think maybe 30 years ago, I think monetarily, maybe that was more the golden age. Today, maybe we're collecting more, maybe we're making more, but our expenses are much higher than they used to be. So there's some podcasts that I've been doing with Garrett Caldwell. He's the CEO of the Pacific Aesthetic Continuum and Core Dental Laboratory. And I hope you have a chance to listen to these podcasts. But what we're trying to stress is that in our practices, we have to run them today like a business. 30 years ago, we were running our practice. We had our production, our collections. We keep track of that. And typically at the end of every month, we'd have some left over. That was basically what we were going to take home. Today, it's gotten a lot tighter. And in the part 3 of making your practice less dependent on insurance, I was talking about how back in the day when we used to take dental insurance, every year you could adjust your fee just a little bit higher, maybe 2%. If you're lucky, maybe 3%. And that was kind of your cost of living increase. Whereas today, the majority of dentists are reporting that if they are accepting insurance, that their insurance reimbursement is going down, which is making it much more challenging to run a practice. I think employees today are a little bit different. Before, you hired somebody, maybe your assistant or your front desk, and they'd be with you for 20, sometimes 30 years. I have an assistant that's been with me for over 30 years now. But then in other cases today, people kind of come and go, and it makes it hard because I'm a small business owner. I don't have a lot of employees, and so when we lose an employee, the time it takes to find a new employee and then train that employee is very difficult. I know some corporate practices, they've got an HR department that will fill in any um, positions, and then they've got training before that employee actually embarks working in that office. Well, in my practice, I don't have that opportunity to do that. I think just marketing wise, making videos and things like this are something we never had to worry about before. How do you get a webcam to work? What kind of audio do you use? And then how do you edit this all together? Those are things that in my practice, I'm thinking about all the time, because I know that other practices out there are putting things out on social media or even on TV. I have practices that are advertising all the time. What I'd like you to do and understand, I guess, from today's message is that you just have to learn to adapt. There's going to be days where there's the challenges, where you have a patient that maybe, you don't match up well, and it seems like you're both frustrating each other. Maybe there's something that happens to a team member, and that makes your day harder because you're working with one less assistant or without a front desk. Those are all things that we just have to accept. We can't control everything. Take a deep breath. Tomorrow will be another day. Hopefully it's going to be a better day. And I think the other thing we have to do is focus on what our game is. And, my game is, when I go to work every day, I want to try to provide the best service I can, but I want to get better at the services that I provide. And sometimes I look at things or services and I think, well, I wish I could learn a little bit more about that. Maybe it's moving teeth, maybe it's placing implants, maybe it's looking at occlusion. And that's what keeps me so excited. So what I now do is, when I go to work and my two front desks are having a hard day because there's family issues and they're going to both be there late, or I don't have an assistant because of illness or whatever may go on, I just take a deep breath. What's the worst case scenario? If nobody shows up and if I don't feel like I can work the office all by myself, we just are going to reschedule a day. Now, we haven't had to do that, but that's probably the worst case scenario. And it will be an inconvenience to some of our patients. And, in our practice, we'll apologize for the inconvenience and try to take care of them the best we can. But some of us on a day like that will just internalize all that, and it just gets very stressful. Dentistry is still a great profession. I love going to work every day. I love seeing my patients. I consider them my family and my friends that I'm trying to keep healthy. I'm trying to help them heal. I'm trying to give them advice. And I'm trying to encourage them by the interactions I have with them. So please, when you go to work, be excited. Think about things that you want to grow in, areas you want to grow in dentistry. Seek out that education. That keeps everything so exciting. And then just kind of take the rough times kind of in stride. Understand that there's more important things that we should take care of, like ourselves and our loved ones, our family. Focus on the good things. Let some of those challenges go by. But like marketing, be excited. If you can learn how to make a video, if you can learn how to do ortho when you've never moved the tooth before, that is some of the richness of dentistry. I've probably practiced every different model of dentistry. I've been an associate. I've owned my practices. I've been in a shared practice. I've been in different practice settings, and I will tell you, they're all good. We all make the best of where we are. And so I would encourage you to keep watching these videos. Share. If you've got questions, let me know what those questions are. I'd be glad to seek out the answers for you. And let's just create this community of richness, a community that supports each other, and a community where we are all responsible clinicians doing the absolute best we can for our patients, keeping our patients top of mind. That's really what all of us at Vista Apex are really dedicated to do. to develop the products that will make your life easier, to provide you the education and the knowledge so you use these products properly. And in the end, we're going to bring about for our patients, our communities, and hopefully the world and beyond that, greater dental health. Thank you very much, and hit subscribe, and we'll see you later and share more ideas. Thank you very much.